Hi everybody, welcome to our module on chest x-rays. Chest x-rays are extremely frustrating to learn at the medical student level, and there are a couple of reasons for this. First of all, it's difficult to see the different structures, so if you've ever looked at the thorax with a CAT scan or MRI, you know that you can distinguish the chambers of the heart and the vessels. It's much harder to do this by chest x-ray. In addition, there are many normal variants, so it's hard to know what's abnormal and what's normal, and then of course there are many pathologic findings. Some reasonable goals for medical students are to know the basic chest anatomy, because you're often tested on this in class or on the boards, and then know the classic examples of pathology. If you just focus on these two things, then when you move into your clinical years, you can start learning the normal variants and the other examples of pathology that are not so classic. So let's start by reviewing some normal anatomy by chest x-ray. One of the first structures you should be able to identify is the trachea, and this is the trachea here. It's this black portion in the neck. And you can see that it's traveling downward from the neck towards the diaphragm. And notice that this trachea stays midline. It doesn't deviate to the left or the right side. That's important to note. In patients who have pneumothorax, you can see a tracheal shift to one side or the other. Next thing I want to point out in this x-ray is that the heart is normal size. So how do I know that? Well, if we draw a line in the middle of the chest x-ray and we draw another line at the edge of the ribs, the heart should finish before that halfway point between those two lines. So this is the distance from the midline to the edge of the rib cage. This is the halfway point, and the heart is smaller than that halfway point. If the heart extended beyond this halfway point, that would be an enlarged heart. You should be able to pick out normal and enlarged hearts by chest x-ray. Next, let's review the vascular structures in the middle of the chest x-ray. And unlike on CAT scan or MRI, it's very difficult to delineate the borders of these structures. You just kind of have to know where they sit. So this is the SVC right here. It's the uppermost structure on the right side of the chest x-ray. Next comes the right atrium. This is the border of the right atrium right here. And then next comes the IVC. The right ventricle, you may know, is an anterior structure, so it just sits sort of right here in the front of the cardiac silhouette on the chest x-ray. And then if we go up the left side, the first thing we come to is the left ventricle. This is the border of the left ventricle right here. The left atrium is a little bit higher up. That's followed by the pulmonary artery. And then finally, we see a structure called the aortic knob, which is not shown that well in this example, but it's a little bulge right here. And that's just a part of the thoracic aorta that's seen normally on chest x-ray. And you should be able to identify all these basic structures of the chest on a chest x-ray. Okay, now let's go through some classic examples of pathology. And the first thing we're going to talk about is pulmonary edema. So over here on the left side of the screen is a normal chest x-ray. And you can see that the lung fields are mostly black without a lot of white stuff in them. Over here on the right is a chest x-ray of a patient who has pulmonary edema. And notice that there's a lot of this puffy white stuff filling the lung fields on both sides. And that's what pulmonary edema looks like. Another important clue to pulmonary edema is that this heart is enlarged. So if we draw a line in the middle of the chest x-ray, and we draw a line here at the ribs, you can see that the heart extends beyond the halfway point. So when you see an enlarged heart along with these fluffy infiltrates, you're probably looking at an example of pulmonary edema. Another classic finding of pulmonary edema on the chest x-ray are curly or septal lines. There are curly A, B, C, and D lines, but the most important are the curly B lines. And so if we look here at this chest x-ray on the right, there's an arrow pointing at a faint white line here like this, and that is fluid filling the space between alveoli and between bronchi, and those are called septal or curly B lines. And they're hard to see at first, but once you get used to looking for them, you can usually identify them in chest x-rays that have those fluffy white things like we saw in the last example. The curly B lines are usually there as well. Okay, next let's talk about pleural effusions, and this is a chest x-ray showing a large left-sided pleural effusions. So the first thing you have to know in understanding x-rays of pleural effusions is the costophrenic angle. So what's that? So the costophrenic angle is right here. I'm drawing it with my white marker here. It's where the diaphragm meets the ribs. And what you see in pleural effusions is blunting of the costophrenic angle. It basically means you can't see it anymore, and that's because fluid has filled this space and it becomes white here, so you can't delineate where the rib cage ends and the diaphragm starts. This patient here has a large left-sided pleural effusion, so you have blunting of the costophrenic angle. We can't see where the diaphragm meets the rib cage over here. It's blunted or blocked. And then we've got white stuff filling this space here. And this is an upright chest x-ray, so gravity's pulling the fluid down, and therefore it's creating this solid white area in the bottom part of the left lung, and that's a left-sided pleural effusion. So when you first glance at this chest x-ray, you may think this black area over here between the ribs is lungs, but in fact it is too black. Look over here in the left lung of this patient. You'll see that you don't see complete blackness between the rib cages. You see little white lines, and those are small pieces of lung tissue that are lighting up on the chest x-ray. Those are absent over here in the right lung. It's completely black in this space between these two ribs, for example, and that's because there is no lung there. This is actually the lung right here. It's been deflated and it's like a balloon that's collapsed, and we just have blank space over here, and that's why it looks so dark. So in order to pick up a pneumothorax, you have to identify that the lung is collapsed down here and that you've got this clear black area between the ribs over here. Small pneumothoraces are very difficult to pick up, but this is an example of a very large, classic appearing pneumothorax that you should be able to recognize for your board exams. Next classic X-ray is lobar pneumonia. So let's look over here in the right lung, and we see this area that is hazy and white. I'm circling it here with my pen. If you compare that to the left side, you'll see that the left side is clear. So this is a patient who has a right upper lobe infiltrate, that's how it would usually be described, or a right upper lobe pneumonia. And you should be able to identify classic examples of lobar pneumonia as a medical student. This is an example of a chest X-ray showing interstitial fibrosis. And so what you see here is diffuse white stuff in all the lung fields, but this is different from that fluffy white stuff we saw in pulmonary edema. This white stuff has spaces between it. It's described as honeycombing. And that's what you see in patients who have pulmonary fibrosis. And you should get good at recognizing this pattern when it's as classic as this example is here on the screen. This is an example of hilar lymphadenopathy like you might see in a sarcoidosis or tuberculosis patients. So the hilar lymph nodes are here on either side of the trachea. I'm circling one of them, and now I'm circling the other one. And they are large and bright white in this chest X-ray, and that's what you see in patients who have sarcoidosis or TB, and you should be able to recognize hilar lymphadenopathy for your boards. And then finally, this is an example of a pulmonary nodule. So pulmonary nodules can be very subtle, and they're difficult to pick up if you don't have a lot of experience reading chest X-rays. But this one is fairly easy to see. If you look out here in the left lung field, you see this circular region here that has whiteness in it. You don't see anything like that over here on the right lung. So this would be a coin lesion, it's called, or a pulmonary nodule, and this is a patient who could have a lung cancer. And that concludes our module on chest X-rays.